This article.
I'm really struggling with this whole thing conceptually.
Could you please pull your mic closer?
Sorry. It's such a bigger project than I imagined. We're talking about 5 mornings at Maple Street and 5 afternoons at the high school. And it's a real struggle, Patty, because I recognize the need that you're explaining to us, but I'm struggling with where's that line between board responsibility and parent responsibility? I know that kids can't come to school sick, and when I think about an individual child, it's a really easy decision to make, but when I look at the bigger picture and our responsibility as a board, I wonder if we're going where we don't belong to the degree that this proposal is going. This RFI talks about enrolled children and their families. Now we got people coming out in their schools 5 days a week. I wonder, setting this up at Maple Street School, there are needy children across the district. If conceptually this is what the board wants to do, then why aren't we taking care of needs across the district rather than just in one place? How appropriate is that? How fair is that? To me, this is way overkill, way overkill. And I take a number of exceptions to, this company is getting everything funded. The dental van, the 6 staff members, everything is being funded, and they're collecting dollars from insurance companies and walking away. This is a big money maker for them. I don't want to be confused about they're doing something out of the goodness of their heart for Vernon. This is a business venture. But I really struggle, never mind the points that David made. I think they're so valid. I can't even get to that spot because this is, I think, an inappropriate use of school space. We just heard BCMS in the high school say they're struggling for places to put their students. Now we're going to have, it's a half a day, 5 days a week. I don't think you should be writing an RFP for this amount of service. Although you had school staff here explaining to us, and they used a very poignant tale to convince us of the need. But I'll tell you, my thought after that was, why isn't the parent accountable? Why isn't DCF? This child was abused, wasn't cared for. So instead of accountability, we pick up the slack. That's a terrible thing to say because I know there's a need. So I don't know where that balance is. Maybe you can help me strike that balance, but I think that this RFI is, I can't support it going forward like that. It's way too much, it's way too intrusive. It's a job that we shouldn't be doing, that we should be helping families do, not doing ourselves. Are we enabling or are we supporting?
I would respond that, I hear what you're saying, I understand what you're saying. The reality is those children come to school and we're held accountable for educating them. And right, and when they don't come to school ready, we are unable to educate them. And so, we can refer them out to, their doctors. We take their parents and them to the ER. We connect them to psychiatric care that they need. And so it all consumes a huge amount of time for just, let's say, one family visit to get to a psychiatrist. A situation where a student is creating a crisis. We balance the being able to educate them, addressing their mental health needs, and then outplacing them. And I think that, to me, I watch the number of students that we're trying to service who have really significant issues. And, I look at some of the communities around us, and I think about what are they doing, and how are they able to meet the needs of kids. Well, I think that I'd like to keep them here. I'd like to address their needs so that I can get them back on track and educate them as quickly as possible. And what happens is, the referral process is just incredibly long. And, personally, I don't care which agency does it. What I know is I need my kids to come to school. My students need to come to school so we can educate them. And there's a large number of kids that are coming to school not well, physically, emotionally, and therefore not available to learn. And so I think we're fighting an uphill battle. I can say it's a parent's responsibility, but I also feel as though we're held accountable for it. We are one of the lowest 30 in the state. So whether we like it or not, we're held accountable for it. And I think this is just a proactive way to try to access our children. So, you know, I totally hear what you're saying. When does it stop? I understand that. And, you know, we feed them, we educate them, we teach them manners, and now we're gonna take their temperatures and provide medical service for them as well.
Can these needs be met on not such a grand, with not such a grand plan?
So that's really they will provide the service to us based on the need. So if we don't have the need, they'll only come to our school 2 mornings a week, or we can limit them 2 mornings a week if that's what we want. We can set the parameters however we choose, and I wouldn't anticipate that they're going to start 5 mornings a week. They're not going to come here and sit in an empty office or an empty space. So, you know, they'll come 2 mornings a week and go 2 afternoons a week to the high school, but if the need is there, we're trying to prepare if there is a need. And you're right, we may need that service over at Northeast School someday. I mean, the mobile dental van will go to all the schools. We already have the mobile dentist come to all of our schools. So now the restorative care can be given in that mobile van, which is what the children don't get. They get cleanings, and there are more and more students being seen. Sometimes when restorative care has been indicated, those students don't get that restorative care. So, you know, I think that we're building out a plan in the event that we might need that. We might not need 5 mornings a week, but, you know, we're going to need to create a space that's an appropriate space, that's an appropriate medical space that ensures security, safety, and that meets the ADA guidelines. We did go and look at the spaces at Rockville High School with the administration and at Maple Street with administration. Clearly, space is always tight, but Dr. Purcell felt so strongly that her kids need this service that she would figure something out, you know, whether that being, you know, doubling up related service staff, or there is just such a need. And she wanted to be here tonight. You know, we've been working on this. We're very anxious to see if we can help our students come to school ready to learn, healthy and ready to learn. And right now, we have no way to impact that, other than saying, you know, your child needs to go to the doctor. We can't get that child to the doctor. And there are times that students will go for long stretches of time sick, just not ready.
How do we address the inequity then of the service we're providing across the district? If it's, I'm sure it's not needy in one place. How do you address that?
Well, you know, Maple Street School does have the highest percentage of free and reduced students. So, I mean, that is our highest percent. We're going to try to hit that first. But that, you know, I've had this discussion with we have a committee in the district, mental health roundtable, where we bring people together to talk about the student needs, and as a group, everybody is thrilled just to get it in town. We'll figure out how to get the kids there, but the schools that don't have it are just thrilled to have the opportunity to be able to say, go during the day, go pop over to Maple Street, get seen by a doctor or EPRN, and then come right back, because that's the other piece that happens. Sometimes kids just need to get their shots. We've got students that have been excluded from school because the parents aren't able to get them their immunizations. It just goes on, the variety of need. And so what happens is our staff spend hours trying to get the students the right care that they need, whether that be tracking the number of kids that didn't get their immunizations or the flu shot. You know, there's a law that says preschool children have to have their flu shot by January 1st. But we had to exclude children from school because they weren't able to get the flu shot yet. So this is a service that we can provide to our students. They're going to be able to get the flu shot. We know they can get it. You know, they can go directly over there. So it's not a cure-all. It's not going to fix everything. But I do think that it's a need that's addressed in Vernon. If we find that we don't have a need for this, they're going to move on. We're going to say goodbye, thanks, and they're going to move on. I think that, but I think to try this and just at no cost to us, with the benefit potentially to our students, I think that I feel as though we owe it to our students to see if we can provide this service at no cost to us and potentially with some benefit to our district. Those, I would be looking at, can they provide me the flu shot? I went to CVS late at night to try to get my flu shot and wasn't able to get it, and so I'm jumping around trying to get my flu shot. So I think some of these services can be provided to staff as well as our students. So that's what we're looking at when we're going to enter into some kind of agreement or arrangement with an agency.
And their families, it says too. So we're not just taking care of kids in the building, their families will be coming and going with their medical needs being taken care of as well.
That's a proposal that doesn't have to be, you as a board could say, no, we just want to treat our school-age children, or we just want to treat just children. Maybe that's the 2-year-old who's got the ear infection as well, who's going to get the sibling sick, But that was the initial request, that when we met with the board, we included that language. Because if mom is homesick, trying to take care of the sick, if mom is homesick, sometimes they will keep an older child home to help take care of the baby because they're too sick to take care of the baby. These are realities. There are realities. This is our community. This is what happens. And we're addressing attendance, and we're trying to address students coming to school ready to learn. So this is just one way.
Mr. Percy, I recognize you. I've seen your hand.
Thank you. Question for Mr. Porcaro. I just want to be clear. If the board votes to send out an RFP, we're not tied to accepting any of them, correct?
That's through you, Mr. Chairman. That's correct.
Thank you.
Ms. Bush.
My concern is the intrusiveness of it and taking space, and you've said yourself that if this doesn't work, they might move on. Why not in the RFP have a provision for either a mobile situation or a portable that can be set up? Then we wouldn't have to worry about construction, we wouldn't have to worry about taking space away from our much-needed space that we need for our students. And if they decide, this is not what our community needs, if it was mobile, it could go to Northeast School, it could go to Skinner Road, it could go where it's needed. And if you see a need in a different school, maybe it spends a little more time there. I really think the mobile idea is a much better idea because we won't be owning it. We won't be having a change in our facilities. And I think it would be a better situation because if it needs to go somewhere, like you said, you have the dental van coming. Why not have the whole thing on the RFP, mobile or portable in some way?
So, I think that it would be worth putting out there. I guess what I would like to say is that I'd like to have the option, could you write one for a mobile, could you write one for a fixed? Because I think there are pieces of creating a school-based health center that, bathrooms, water, air exchange, all the things that are met by the health codes. So there are things that maybe, I don't know, I'm just not sure how mobile that can be and whether or not it meets the needs, but we could certainly put that out there.
Thank you.